Good morning. My name is Nigeria. I will be discussing IPV today and starting off along with the fact that IPV is for mucus clearance. It is also indicated for treatments like consolidation, so like um, pneumonia, atelectasis, ARDS, and inhalation burns. That's what it would be for. And it is a safe and traditional bronchial hygiene therapy. And it is also it's a very good preferred therapy as well. So starting off, you're just going to simply review the physician's order, review the patient's chart. You're going to make sure you walk into the room, and before you walk into the room, get all of your equipment, which you would need the IPV, the circuit assembly, the nebulizer, medication. You'll also need, I believe it is the you need the appropriate patient's interface, so like the type of mask or whatever you're going to use, and suction equipment as well. So, with that being said, you're going to walk into your room with um, all of your equipment, and then you're going to introduce yourself to the patient. Hello, my name is Nigeria. I'm a respiratory therapist for today. I will be doing a IPV treatment on you. And so you're just going to apply hand sanitizer and ask the patient to verify their name, date of birth, so you can make sure you're giving the correct therapy to the correct patient. And then you're going to explain what the IPV is. So start off by telling them exactly what I said at the beginning of this video. And then before you do any type of therapy, you're going to always take vital signs. You're going to measure their heart rate, the respiration rate, their blood pressure, the color of them, their see if they have any dyspnea. You're just leveling every single thing, doing the breath sounds evaluations, make sure you're locating any type of abnormal sounds. It's just very important to take their vital signs before doing the therapy and also sometimes while doing the therapy, but before and after for sure, because you need to know if this therapy is even effective for them. So you're going to make sure that you connect the IPV to the oxygen, and then you're going to make sure that the nebulizer and everything is inside where it's supposed to be, and you're going to make sure you're giving the prescribed medication to the patient and then putting it over their face. Um, and you might have to adjust this as well. Make sure that the control knob is in between 20 to 25 psi. And then you're going to just make sure you're telling the patient how to. You're going to instruct the patient to breathe in the nebulizer for 1 to 2 minutes, and then you're going to tell them to decompress for 10 to 15 seconds while um, they're inhaling and exhaling through percussions. So this is when you'll percuss on the patient, make sure that the medicine is getting where it's supposed to be, and then you're going to also adjust the pressure up to 30 to 40 psi as well. And you should also visualize. You're also going to be able to see the chest wall moves. So if it's too high, it's going to leak. So make sure it's at the perfect um, flow. And then you're going to wait 15 to 20 minutes during the treatment before you adjust to a different um, before you adjust to a different flow as well. And make sure that you're encouraging patients to breathe periodically so it can enhance the secretion moves so it can really get into the system. And then you're going to assess the chest wall, making sure you're looking for the oxygen. So for mechanically ventilated patients that are unstable and cannot be tolerated being disconnected, you're going to desaturate and make sure the PEEP levels are above 10 centimeters of H2O. And then just make sure everything is properly put in place once again. And then their pressure should be 20 to 25 PSA. And you'll turn it on, you'll observe it, make sure your test running it, connect the IPV. Connect the IPV in line, make sure you're initiating pressure, control ventilation, and just know that there's certain ones that you will be able to use And the IPV mechanical ventilator, it is designed to use separate inspiratory and expiratory lines. So you'll make note of that and turn the unit on and allow the aerosol to flow through the circuit for about 1 to 2 minutes. And then you're going to complete ventilator cycles. You're going to complete 2 ventilator cycles, and you're going to make sure you adjust your pressure, and relieve the valve so that during the ventilator breaths, the valve is not relieving. So after 5 cycles, you're going to deflate. You're going to slightly deflate the cuffs so you can allow an alternative route of secretion removal. And then you're going to percuss the pressure up to 30 to 40 psi until you see chest wall movement. And once you see that, then you can then you'll be able to maintain the oxygenation and ventilation. And you're going to adjust the frequency as well and make sure you go from easy to hard. And make sure that you're getting the actual medication into the chest wall so it can mobilize the secretions. And during the treatment evaluation, the patient secretion and production, you'll have to suction as necessary, and make sure you're looking at the chest walls and saturation as well, and check the vital signs again.